As you know, month of October is the Global Breast Cancer Month Awareness. And as Friends of Cancer Patients, we have worked really very hard to advocate for the breast cancer awareness on many levels and sectors in UAE community. Our flagship campaign is Pink Caravan, and we have launched Pink Caravan 10 years ago. And the idea of Pink Caravan is to provide a 360 solution to breast cancer screening, not just awareness. So Pink Caravan is the whole spectrum, starting from education, which is very important. So we educate the community, we spread awareness about breast cancer, until we do an actual screening for the woman. We also teach her how to do self-breast examination, and also advocate that she should go and visit a doctor and do clinical examination at least once a year. And of course, the active screening, where we provide a free mammogram through our Pink Caravan mobile mammography clinic. The other end of the spectrum is if the woman gets diagnosed with breast cancer. And throughout the years, we have screened over 70,000 women and men in the United Arab Emirates, and we have discovered 80 positive cancer cases. So we do support women as well through their cancer journey, till their survivorship. And alhamdulillah, we have now many survivors who came on board again with us to become ambassadors and to become spokesperson about their journey, but also to encourage other women to make sure they get the screening. You mentioned scientific research. That is very important. I think that's the missing puzzle in our activation. And I think scientific research will be and will have a great impact in the future. We will see acceleration in scientific research in the coming few years, because especially now with Pink Caravan, I speak on behalf of Pink Caravan, we personally have a lot of database that we will be, inshallah, utilizing in scientific research very soon. So scientific research is a very important cornerstone in the development and advancement of breast cancer, either breast cancer in its advocacy and its health literacy phase, or even in the screening, or even after the diagnosis, where we will need better availability of medication and drugs, but also a fair, affordable medication and drugs and treatment for breast cancer patients. So I will speak about my personal experience when it came to breast cancer. Friends of Cancer Patient has been around for 21 years, actually, and that's very impressive. We have been organized and launched to do three things: provide access of care for cancer patients, provide community awareness, and provide them with credible information about prevention and early screening. And also, we do a lot of advocacy and lobbying when it comes to cancer, and we lobby policymakers as well to make sure that cancer patient voice is heard on all levels. Now, if we had done this interview 15 years ago, it would have been very difficult for me to say the word cancer or the word breast. And it did happen to me personally. I was interviewed in one of the national TV stations. I'm not going to mention the name. And during the intermission, the producer talked to the anchor woman who was interviewing me, and he asked her, please tell the doctor not to mention breast on national TV. And I was in a very weird situation, because I was there to speak about our endeavor and our experience in hosting our third breast cancer awareness session. Back then, it wasn't called Pink Caravan, it was called Taw'iyah, which means awareness. So you can see how far we came. And of course, through using mainstream media and using newsstream media like what we're doing today, helped a lot into raising the bar when it comes to the awareness. I wouldn't speak about just the United Arab Emirates experience or the Arab world experience. I would speak globally. During my career, I met lots of women from all walks of life, from different nationalities, you name it, north, south, east, west. And to be honest, I found that us women, we have a very common way of thinking. We never put ourselves first. It's always the house, the children, the husband, the family, the study. I need to do this chore, I need to do that chore. And when it comes to, oh, I need to do my mammogram, it's never a priority. And it doesn't matter if I am a well-educated woman or I am not an educated woman, if I come from a very developed country or I come from an underdeveloped country. It is the same for us women. I think we have a gene that just tells us that, your priority is everything else except you. And I think that should change. Because if you cannot take care of yourself, you cannot take care of the people you love around you. And so I believe that we have come far away when it comes to breast cancer awareness and the screening. And there's lots of amazing, brilliant patient advocates around the world who are now really pushing and raising the bar when it comes to educating the community, educating other women, but also providing solutions as well. It's not just talking, it's about providing solution and providing a real life evidence about, you need to do this because we want to save life. We are in the 21st century, we are in 2020. Until now, we have women dying of cancer, breast cancer. And that, for me, is a crime. If there should be no woman dying of breast cancer, especially where we have reached such an amazing advances in treatment and screening that really even metastatic breast cancer now has been considered as a chronic disease, not as a fatal disease. So globally, I believe, not just UAE, not just the Arab world, I mean globally, I believe we have really reached a very high stage in development where it comes to breast cancer, but we're not there yet, because the only time we will say we have reached is when we find 0 death from breast cancer. NGOs play a pivotal role in bridging the gap in the community. So you have governmental sector, you have private sector, you have community. And what NGO does is just bridge all that together. They bring people together and bring the community together to make sure that that target group, especially I'm talking now about breast cancer patients or breast cancer awareness, is heard on many levels. Also, NGO is an enabler. It can enable private sectors, especially people who are companies who have CSR as part of their DNA in the organization, can help companies reach their CSR potential. There's lots of companies that we meet that say, well, we really want to make good. We want to really create an impact in the community that we work in. And we have a very active and robust CSR program, but they don't know what cause they should focus on. And I believe having credible NGOs and partnering with credible NGOs can help do that, because NGO can make sure that you reach your CSR target, but at the same time making sure that the impact is great on the community and as large, but also for the community they target as well. In this case would be breast cancer patients. So NGOs really, but what NGO needs to do, NGO needs to learn how to speak not just NGO language, but they need to speak business language as well, and they need to speak community language as well, and they need to speak government language as well. And I think that's the challenge for NGO. And this is where you find different NGOs on different levels. So you have very really advanced NGOs who have been doing an impact. It doesn't matter how many years they have been around, but it's how their adaptability and what is their adaptability to be able to, again, it's the word bridge the gap between different community sectors, whether it be government, private, or even the community itself. There was a nice research that was done. It's a nice paper that was done in the collaboration of the UK government and UNICEF, World Bank, and WHO. And talks about the 9 principles for digital development. And I believe this 9 principle is pivotal not just for digital development, but for any innovation you want to undertake. And it's really interesting, those 9 principles, because they speak about if you want to develop something, you have to develop something that you can scale. You have to develop something that you can use and reuse. You have to develop something putting the user in mind. The problem is we call the patient end user, but he is not the end user. He is the first user. And he has to be in the core of development, where it is in the clinical trial phase, or even at the end when you try to disseminate the product, whether it is what is a medicine or what is a new invention or a technology. The patient will be the one using it and also maybe paying for it. So it's very important to have the user in the process of, even in the design process, not even at the end of when you get the product out. They talk about collaboration and using real-life data as well. And I believe if you look at the 9 principles, it can apply to any innovation idea. So, especially now, we're talking about looking at innovation from a different lens, because we are now in COVID-19. Lots of patients would appreciate if we look at innovation in medication, where they don't have to go to the hospital because they cannot. It's COVID, it's pandemic, you have to stay home, their immunity is low. So what are we doing to make medication more accessible for patients? Not without the idea of them going to the hospital. What are we doing to make chemotherapy more accessible to patients without having them having a portal to have the chemotherapy inserted in them? So all those ideas are important ideas, and really I think COVID has given us the opportunity to relook at how we do our day-to-day business and our today operation, and say, what if in the future we're going to get over COVID, definitely. But what if in the future we're going to have another pandemic or another situation where people have to change their life and adapt to it? So I think when we speak about innovation right now, I think we always have to remember COVID as a good example of what if in the future. Yeah, AI is the new kids in the block. It's coming really big and really fast, and I think it will play an important role in the industry in the coming few years. But I want to reflect on the word patient-centricity, because we use this word a lot. In the hospitals, in the clinic, pharma industry, technology industry, the industry at large, we are patient-centric. But what does that mean, patient-centric? I think we overuse that word without actually reflecting on what does it mean. For me, when you say patient-centric, it means the patient is in the center of whatever you are doing. Having the patient present when you are even thinking about the design of a clinical research, the patient or a patient group has to be there. If you're thinking about looking into a technology, a digital technology, to enhance the patient, was it a system or is it a new machine? The patient has to be in the inception phase, not as the end user phase. So I believe that people need to now reflect on the word patient centricity, and whenever they use that word, they need to explain what do they mean by it. Because we have been using it left, right, and center without actually acknowledging the real issue and the real need of the patient. Nobody actually asked the patient, how would you like us to really focus on you and be the center of the attention? They need to ask the patient, because they can give more insight than me sitting with 100 expertise, with all respect to everybody, and saying, okay, how can we be more patient-centered? And none of those 100 people are actually an actual patient. So patient centricity is a word that has been used many times, and I believe not just used, but abused. And I think we need to really re-examine how we use that word and make sure that it does mean action, what it actually means. The world is heading towards a new global economy, and I believe the world will change the way we perceive it right now. And I believe social enterprise will lead that. And of course, lots of young entrepreneurs want to create a business where they can benefit, but also have an impact on the community. My main advice for them would be, put yourself in the shoes of the community and say, what does the community need? What should I provide? But put yourself in their shoes and don't think with your brain, but think with your heart. Because really, if you look at the history of social entrepreneurship, people who produced something that really impacted their community and their environment led the way when it came to business. And people who lead from their heart and lead with compassion are actually the greatest leaders. And I think that's the magic combination, is that just think what my community wants. How can I enhance that? How can I eliminate something that the community doesn't want? But most important thing, how can I really impact the community and make sure that there is compassion among the individuals in the community? AI, it's still in its early stage, and AI needs to learn. And for AI to develop, it needs to learn. So it's like us when we were young, we had to go to school to learn the ABCD, the 1, 2, 3, for us to be able to read and for us to be able to learn more and progress in our education. And I think this is where AI right now is. And more collaboration with entities and companies that working with AI base with NGO is amazing, because NGOs can provide a platform for AI to learn. And I believe I've read a lot of research about when AI actually develop failures is because they're just learning from us, and we have our faults and failures as well. And I believe that's how AI can learn more. Now, talking about this, we have to learn from AI as well. There's lots of discipline that has to be developed around AI, like what is the ethics of using AI? How can we actually utilize AI? Lots of people are afraid that AI will come and replace human beings. I don't think that's going to happen, because human beings will always be needed. Although AI is magnificent as a brain, but human being brain is more superior because we are teaching AI at the end of the day. So I think we need to look very, very closely at the whole ecosystem of the AI. So it's not just the AI and we get very excited about it. Yeah, of course, we have to get excited. It's the future. But we also need to look at the ecosystem around the AI, us as human beings, what we need to learn and evolve to be able to match the AI. So it's not just, companies partnering with NGOs, because NGO represent the community, but it's all the community coming together to make sure that we have really the bright future that we dream of when it comes to incorporating AI in everything we do.